You've probably been seeing good-looking people all over the internet, getting themselves really hot and really cold in different small-sized chambers like saunas and cryotherapy booths. Does this really work? Let's get into it. Let's talk about what it's good for, what it's not good for, and what the data are behind it. So there are a couple different ways to get yourself hot. You can get yourself hot in a wet sauna or a dry sauna. A wet sauna meaning like a steam room. Most of the evidence comes from dry saunas, so we're going to stick to that category. And that can be separated into two different kinds of saunas. There are the normal kind of sauna that you might have been to in a gym before. It usually looks wooden and heats the air, so you roast yourself like a little Thanksgiving turkey. An infrared sauna works a little bit differently. It emits thermal radiation that directly heats your body. So while it's heating the air up and the room does get warm, the room doesn't have to get as hot for you to sweat as quickly because you're heating up the actual body with that thermal radiation. So when your body's core temperature increases, you have what's called a thermoregulatory response. It's basically your body scrambling to get stuff back to normal. And this induces a couple systems: the cardiovascular system, your heart, the neuroendocrine system, your neurotransmitters and your hormones, and also a cytoprotective response, so the response that wants to protect your tissues and your cells. Basically, this is a tiny short-term stressor. These little stressors, called hormetic stressors, actually cause the body to dampen its own inflammation, starting its own anti-inflammatory response. It has a kind of complicated name: anti-pro-inflammatory. One study of 2,300 middle-aged men found a strong link between sauna use and reduced death and disease. The men who used saunas 2 to 3 times a week were 27% less likely to die from a cardiovascular-related disease than the people who didn't. The same frequency of sauna use was associated with a 66% lower risk of Alzheimer's disease. Mental health benefits were also seen in this study. The men who used saunas 4 to 7 times a week were 44% less likely to develop psychotic disorders. There are other psychological benefits associated with sauna use as well, including increased feelings of well-being, decreased pain tolerance, and increased self-esteem. There are also several studies that report that spending time in infrared saunas may be heart healthy and may actually improve the endothelial function of the vessels, which allows the vessels to expand and contract more fluidly. Infrared saunas may also help regulate heartbeats of people who have irregular heartbeats and also improve scores of physical fitness. Another study found that 15 minutes a day, 2 times a week in an infrared sauna was enough to lower people's blood pressure significantly. That kind of speaks to why infrared saunas are great, because they tend to work fast and they get you to sweat quickly. We also know that sweating in any capacity has great detox benefits. There are a lot of heavy metals that are excreted way more efficiently through sweat than through urine, which is our only other way to really get rid of them, like lead, cadmium, and arsenic. We also get rid of BPAs much better through sweat than through anything. BPAs are endocrine disruptors, and we're exposed to them through plastics every day. We also get rid of phthalates, which are also endocrine disruptors through sweat. So we're exposed to these toxic compounds every day, so any way you can find to get them out of yourselves, definitely do it. It doesn't matter if it's infrared or normal sauna or even just exercising, any sweating will excrete these compounds. So while heat shock has a host of benefits for cognitive function, cardiovascular function, anti-pro-inflammatory activity, and cellular function, just sweating is really good at eliminating toxins. So even if you can't get in a sauna, try to be sweating a couple times a week. So what is cryotherapy? It's basically exposing the body to extreme cold for a determined period of time. There are several ways that people get this done. The most popular one lately is putting yourself in a cryotherapy chamber that cools the air around your body. But there's also a pretty old school way, which is just putting yourself in a bunch of ice water. So what is cryotherapy good for? Some of the most clear-cut scientific evidence exists around cryotherapy's effect on the brain. Cryotherapy causes us to release a neurotransmitter called norepinephrine. Some people colloquially would call this adrenaline or noradrenaline. The release of norepinephrine is anti-pro-inflammatory. Like I just explained before, it dampens our body's own inflammation and causes anti-inflammation in our body. So it protects our body from cognitive decline. That spike in norepinephrine can also dampen inflammation elsewhere in the body. So this is really good for people with body pain and arthritis, and it's really good to improve muscle, joint, and tissue function. If you're suffering from chronic pain, small bouts of cold stress might be a really good thing for you. We also know that exposure to cold increases a type of fat called brown fat. Now, brown fat is actually more common in babies. We lose brown fat as we age and replace it with white fat, which is more associated with adulthood. But brown fat is a lot more active than white fat. Brown fat burns off calories faster. That's what keeps babies warm, because they have so little on their bodies to protect them. The brown fat is used to protect them. So having more brown fat as an adult is associated with overall lower body fat, because that fat is so metabolically active, it's throwing off calories for you all the time. So a great way to increase brown fat is to get yourself cold. So does it matter whether you get yourself cold in an $80 cryotherapy chamber or an ice bath at your house? It looks like it doesn't. The research looks like it actually cools your body faster to be submerged in ice water, and the benefits from a 2 to 3 minute cryotherapy session look equal to those from 20 seconds of ice water submersion. Both ways to get yourself cold, though, will cause that increase of norepinephrine in brain and will, over time, increase the amount of brown fat on your body. By the way, if you want to spot treat the brown fat on your body, the place that adults have the most of it is right here behind the neck. So if you're going to get any part of you cold, right there behind your neck is the best place to do it to increase your brown fat. Even though getting yourself really cold has benefits for body composition, it's not great to do it directly after a workout if you're interested in muscle gains. The reason is that when you work out, it's that same kind of small stressor, that small hormetic stressor that actually creates a small amount of inflammation in your body, and that's where the muscle gain comes from. So if you dampen that inflammation, you're not going to get as much muscle gain. Obviously, make sure you're healthy enough to do hot or cold therapy. Make sure your body's healthy enough to handle that small amount of stress you're going to give it, and the best way to do that is just ask your doctor if it's okay for you.